Nicotine, a drug that is taking over this school at a very rapid pace and maybe even our whole generation. I know many of you are probably very familiar with these things on this screen, and I know many of you have probably see this on a day-to-day basis. When I was growing up, my family, specifically my parents, were highly addicted to cigarettes, and I never realized how bad it was for your body until I went through the DARE program. So through this speech, I'm going to teach you about what nicotine is, the histories, and some harms and benefits. So what is nicotine? In a 2018 article by Medical News Today by Adam Feldman, nicotine is a chemical that is based on nitrogen that can be produced synthetically, or it can be found in a plant like tobacco. Also from Medical News Today, nicotine is a very highly addictive drug that can almost be as hard to give up as a drug like heroin. And if you don't know what heroin is, it's a very hard drug to give up. Across the planet, 1 billion people use nicotine on a day-to-day basis, and most people know or think that smoking or inhaling nicotine is the most effective way, but actually it's chewing or snorting nicotine. So now that we know what nicotine is, let's get into the history of nicotine. So, in an article by Adam Feldman, produced by Medical News Today, tobacco was found by Christopher Columbus when he was discovering America, and it has been used across the globe for 2,000 years as a stimulant or for medical reasons. In the 1600s, this is where nicotine pipes and tobacco pipes and cigars really started to take off. It was a very controversial drug. People didn't know whether to think if it was a good drug or a bad drug. But in the 1880s, this is where cigarettes really started to take off. There was a machine that was created that could mass-produce cigarettes at a very rapid pace, making it easier for people to get tobacco even faster. But then the U.S. started to realize how bad it was for your body, so they created some laws that prevented minors from obtaining nicotine so easily and at all. So now that we know the history, let's get into some harms and benefits. In an Indian journal titled Harmful Effects of Nicotine by Dr. Pankey, nicotine is known to have some symptomatic side effects in addition to being highly addictive. It can affect the heart, the reproductive system, the lungs, and even the liver. When you inhale the drug, it causes a severe burning sensation in your throat and mouth, and that can lead to increased saliva, nausea, or even diarrhea. In the book Nicotine, Safety and Toxicity by Neil L. Benowitz, a professor at the University of Cal, nicotine really affects the heart, and it affects the heart by increasing your heart rate. It makes your heart muscle work harder with every beat, and then it decreases your radius of your blood vessels, making it harder for your heart to push blood wherever it needs to go throughout the body. In a 2014 article from Discover magazine titled Nicotine, the Wonder Drug, nicotine was actually found to have many benefits as well. Nicotine can help people lose weight. and it can also be a cognitive enhancer, while it can also increase your attention or focus. But the number one reason we've been using it for medical reasons in the past years is for Parkinson's disease. It helps with people that have this disease, and it helps them from shaking and actually can increase their coordination. So today we went over what nicotine is, the history, and some harms and benefits, and I hope with knowing this information that you are a little more informed what people are putting into their body, or maybe what you are putting in your body, and I hope you can persuade yourself to stop nicotine, or maybe you can even persuade other people that you know are intaking nicotine. Especially that we're going to college, you're going to see it more on a day-to-day basis, and I hope you guys learned something today. Thank you.